Hello, how are you?
Hello, how are you today?
I'm doing well, thank you.
Thank you. Okay, everyone gets headaches from time to time, as you know, whether it's a tension headache or the most disabling of all, a migraine headache. But when you get frequent migraines every month, you may actually have a neurological condition called chronic migraine. Here now to explain what a migraine is and how it's different from a regular headache or a chronic migraine is neurologist Dr. Jesse Ailani, a director of the MedStar Georgetown Headache Center, a certified neurologist and headache specialist. So it's good to be able to talk with you about this important subject today.
Yes, thank you so much for taking the time to talk about migraines.
Okay, Dr. Ailani, what's the difference between a regular headache and a migraine headache?
So a regular headache is something that most of us have experienced at some time in our life. When you're under stress, you didn't sleep well, you didn't eat your lunch in time, you notice a little bit of pressure behind the eyes or in the temples. You take something over the counter, the pain goes away, you don't even think about it again. A migraine headache can start that way, but then can become more moderate or severe. Sometimes it can even start really severe when you wake up in the morning. And a migraine headache comes with other symptoms. Light, sound sensitivity, your stomach gets really upset, you might start to throw up. You want to be away from other people. Physical activity makes it worse, so just walking around can make the pain even more severe. And people will often find themselves wanting to be in a dark, quiet space to try to get themselves feeling better.
And that's the migraine. Now, how does the migraine differ from the chronic migraine?
So it's a good question. The difference between episodes of migraine, when they're happening and then they go away, and chronic migraine really comes down to frequency. So people with chronic migraine are having headaches more than half the days of the month. At least 15 days in a month they're having some sort of headache, and at least 8 of those are more severe, like migraines. And when this is occurring over time, the brain actually starts to learn the pattern of having headaches, and it becomes easier for the brain to have headaches more times than not. And that's the real difference between episodes that go away and chronic, where it's kind of lingering for long periods of time.
I see. So if one has chronic, usually means ongoing or long term, and so with the chronic migraine, it happens frequently, usually during the month?
Yes, so you're having them about 15 days a month. At least 8 of them are being migraine-like in nature. So yeah, they're very frequent.
Okay. And who should a person see if they think they're having chronic migraine?
So if you think you're having chronic migraines, a good place to start is keeping track of your headaches at home, keeping a calendar, writing down the days that you're having headache, symptoms that you're getting with your headache, writing down if you tried any kind of medication is needed to get rid of the headache itself, and then writing down other things that might come around the same time. Like, did I get my period right before that migraine started? Have I been drinking more coffee, under more stress, sleeping less? These kinds of things, these triggers, can be the initiating factor that starts the brain into that cycle of migraine. So it's important to keep note of this, and then to think about talking to your primary care provider and discussing all the symptoms you're having. And if that doesn't really take you to where you need to be and feeling better, think about seeing a headache specialist. This is somebody who's certified and trained in taking care of patients with migraine and chronic migraine. And you can open up a discussion about different treatment options.
Okay. What is the difference between preventive and acute treatment?
So when we're looking at treatment options for migraine, you can try to treat the headache when it comes. That's an acute treatment, something you take either by a pill or a spray or an injection at the start of the headache, and to try to get rid of that headache within the next 1 to 2 hours. If you're getting headaches, if you're getting migraines 4 days or more a month, you might want to be on something that's called a preventive, something that actually stops the headache from starting so that you're having less often headaches. For episodes of migraine, this might be a pill prescribed by your provider to try to prevent the migraines from coming on. From chronic migraine, currently there's only one FDA-approved treatment to prevent migraines, and that's Botox. Botox is a series of injections given every 3 months by a healthcare provider in a very particular protocol to try to reduce the frequency of migraines. It can reduce the frequency by 8 to 9 days less per month over time.
That's interesting. Botox is fairly well known for other purposes, but you're saying it's especially helpful for chronic migraine?
Yes, so Botox actually has a lot of different indications, but one of its most important indications, at least to me as a headache specialist, is its indication to prevent chronic migraine. And right now it's the only treatment that's government approved for chronic migraine itself.
And when you say government, you mean the FDA?
I mean the FDA, yes.
Okay. Who should you see? I guess you say if you think you're having chronic migraine, the first thing to do is to see your primary physician?
Yes, and it's important to realize that you're not alone. It's part of why I've teamed up with Allergan to talk to you about chronic migraines. It's really common. 3.2 million people in the U.S. have chronic migraine, and yet less than 20% are actually given a diagnosis of chronic migraine. So it's important to have that conversation first with your primary care provider. And again, if you don't feel like you're getting the treatment that you need, thinking about seeing a headache specialist.
Okay. And what advice would you give to someone? I guess you're telling me this. The best advice to give to someone who thinks they might have chronic migraine is to follow those directions.
Yes, is to stand up for your migraines. Don't take this sitting in silence. Don't think that nobody cares and nobody wants to know and that there's nothing you can do about it. It's really important to realize you're not alone, that there's treatment options available to you, and there's a type of doctor that this is all they do all day, is see patients who are in similar conditions, and they could potentially give you some options to make your life better.
Okay. And where can people go for more information on migraine?
Well, there's several great websites that can help you on your journey to getting better with migraines. One great website is Botox.
Let's go slowly so that we can be sure people get them.
Sure. So one great website is BotoxChronicMigraine.com. I think that's a good starting place for people with migraine to get some tools on how to talk to their healthcare provider.
Okay, that's Botox Chronic Migraine?
BotoxChronicMigraine.com.
ChronicMigraine.com, okay. Is there another one, or is this the one you would recommend?
That's the one I would recommend to start. There's several other great websites. The American Headache Foundation, American Migraine Foundation has some great unbranded literature for patients to read. And there's a couple of great blogs out there, migraine.com, which is run by patients who sit there and give you their stories, their perspective, their experience, and their journey, which I think can be really inspiring if you're a patient yourself and you think you're the only one out there. Hearing from people in similar situations can be really empowering.
So now we know about Botox Chronic Migraine.com is really recommended by you. But then you mentioned American Headache Foundation. What's another one?
So American Migraine Foundation, you can just Google search that.
American Migraine Foundation.
And then migraine.com, which is a blog website run by patients that give you their experience on migraines.
Okay, so that gives you sort of a support system.
Yes, which is really important when you're suffering.
Okay. Well, I certainly appreciate having this opportunity to talk to you, and I'm sure my Health Power audience will appreciate getting this additional information.
Well, thank you so much for taking the time to learn more about migraines.
Okay. Have a good day.
You too.